So today's topic for discussion is thumb sucking. Sucking habit is the first coordinator muscular activity of the infant. So the sucking habits can be either nutritive sucking habits like breastfeeding or bottle feeding, or non-nutritive sucking habits like thumb or finger sucking or pacifier sucking. So let's see the definitions for thumb sucking. Gillian defined thumb sucking as placement of thumb or one or more digits in varying depths of the mouth. Moyers defined thumb sucking as repeated and forceful sucking of thumb with associated strong buccal and lip contractions. So the thumb sucking can be either psychological or it has a habitual thing. So when it is a deep-rooted emotional factor which is involved or associated with thumb sucking, it becomes psychological. It may be associated with the neglect and the loneliness experienced by the child. Habitual does not have a psychological bearing. However, the child performs the act. So let's see the classification for thumb sucking. So according to the subtelny, there are four types of thumb sucking. The type A, which is seen in 50%, that is when the whole digit is placed inside the mouth with the pad of the thumb pressing over the palate, while at the same time the maxillary and the mandibular oral contract is present. In type B is seen in 13 to 24%, where the thumb is placed into the oral cavity and at the same time the maxillary and the mandibular contact is maintained. Type C is seen in 18%, where the thumb is placed into the mouth just beyond the first joint and contacts hard palate and the maxillary incisors, but there is no contact with the mandibular anterior incisors. Type D is seen in 6%, wherein only a little portion of the thumb is placed into the mouth. Now let's see some of the theories and concepts which has been associated with thumb sucking. The first one is the classical Freudian theory given by Sigmund Freud. According to this theory, this is based on the psychoanalytical theory. According to this theory, a child goes through various distinct phases of psychological development in which the oral phase is the first phase of a life, and in this phase, the mouth is the erogenous zone. So during the phase, child takes anything and everything to the oral cavity. So the any kind of deprivation of this activity will probably cause an emotionally insecure child. According to the learning theory given by Davidson in the year 1967, this theory advocates that non-nutritive sucking stems from an adaptive response. The infant associates sucking with feelings like pleasure and hunger and recall these events by sucking the suitable objects available, which is mainly the thumb or the finger. Now, according to sucking reflex by Ergel in the year 1962, according to him, the sucking reflex is something which is seen as early as 29 weeks of intrauterine life, and it may disappear during normal growth between the ages of 1 to 3.5 years. Babies who are restricted from sucking due to disease or other factors become restless and irritable. This deprivation may motivate the infant to suck the thumb and finger for additional gratification. Now let's see some of the causative factors for thumb sucking. So digit sucking has also always been proposed as an emotional based behavior related to the child having difficulty with social adjustment or with stress. Now, this habit has been most commonly seen or associated with working mothers because the children brought up in the hands of caretaker may have feelings of insecurity, and to escape that from insecure feelings, the child may go take thumb sucking as a habit. Next is the age of the child. Now there's a number of siblings. The development of the habit can be indirectly related to the number of siblings. Now, order of the birth of the child, then the socio-economic status. All of this have influence on taking the thumb sucking, making habit as thumb sucking. Now let's see the diagnosis of thumb sucking habit. First, the history plays an important role when we are managing a thumb sucking patient. Next is the emotional status of the child, then the extraoral examination, and then the intraoral examination. So, coming to the history, once a positive history of habit is determined, the questions regarding the frequency, the intensity, and the duration of the habit has to be asked. The remedies that have been tried at home, the feeding patterns, the parental care of the child is also ascertained. Now, it is very essential to determine the emotional status of the child to know if the habit is meaningful or empty. So it requires an insight into the emotional security and the familial well-being of the child. Now they're coming to the extraoral examination. You can clearly observe the child's finger or a thumb for a clean dishpan thumb. And there you can see a callus formation on the digit of the patient. The lips of such patients will be short, hypertonic upper lip, and the lower lip will be hyperactive. They will usually have a convex profile, and the other features, the child will have higher incidence of middle ear infections and frequently have a large tonsils accompanied with mouth breathing. Coming to the intraoral examination, let's see the effects on the maxilla. There will be proclination of the maxillary incisors, leading to an increase in the maxillary arch length, anterior placement of the apical base of the maxilla, increased clinical crown length of maxillary incisors, high palatal arch, atypical root resorption in primary central incisors, increased trauma to maxillary incisors, and the mandible, there will be retroclination of the mandibular incisors and the retrusion of the mandible. Effects on the inter-arch relationship, there will be increased overjet, decreased overbite, posterior crossbite, and an anterior open bite. On the lip placement and function, there will be development of tongue thrust, lower tongue position, hypertonic upper lip, and hyperactive lower lip. Now, there are different treatment strategies for managing a thumb sucking habit. The first thing is preventive treatment, then comes a psychological therapy, chemical treatment, reward system, mechanical therapy or reminder therapy, and current strategies. So, the first one is a preventive therapy. How can it prevent a child from developing a thumb sucking habit? That is, feed the child or feed the baby whenever he is hungry, and most may make sure that the child is fed in a natural way, which leads to the importance of breastfeeding. That is, the breastfeeding is primarily psychological and then only secondary nutritive. Psychological therapy. The psychological status of the child plays an important role in thumb sucking. So, diagnosis and management of any psychological problem should be planned before treatment of any potential or present dental problem. Then, the next step is we have to know the attitude of the parent, that is, the parental concern regarding the habit. Parents should be advised to stop scolding, nagging, or reprimanding child. Rewards or bribes are to be avoided while positive behavior is reinforced. Child should not be embarrassed or criticized, rather help should be offered to deal with his difficult habit. There is what Dunlop's theory, beta hypothesis, which states that the best way to break a habit is try conscious, purposeful repetition. According to this theory, the child is made to sit in front of a large mirror and suck, observing as he does so. The timing of sucking should conflict with some pleasurable activity the child usually enjoys. By practicing the bad habit with the intent to stop it, one learns not to perform that undesirable act, and it should can be practiced only in older children, not in very young children. Now, there is something which is known as reward system. According to this, the praise from the parents and the dentist plays a large role for the child to stop the thumb sucking habit. This, according to this, they can make a home chart, and by placing sticking on stars on a homemade calendar when the child has successfully avoided the habit for an entire day. And we can keep a specific time period for a week or a month. And at the end of the specific time period, if the child has not resorted to the habit, the reward is presented with verbal praise for meeting the conditions of the contract. So the reward system has also been found to be very effective for children to help in stopping the thumb sucking along with other management systems. Now you have chemical therapy, that is to paint a commercially available bitter substance to the fingers that are being sucked. But this is considered to be a least effective method. Some of the chemicals which are used for this therapy is like casein red, pepper dissolved in a volatile liquid medium, quinine, or asafoetida. Now let's go to some of the other approaches. The first one is a extra oral approach. That is a mechanical therapy. In extra oral approach, you can use mechanical restraints applied to the hands and digits like splints, adhesive tapes, thumb guards, or mitten or sock or boxing gloves to cover the fingers of the hand, which is useful during sleeping hours, can also be used. Now, Norton and Gillen proposed a three-alarm system often effective in children between 3 and 7 years of age. In this, the offending digit is taped, and when child feels the tape in the mouth, it serves as the first alarm. Now, a bandage is tied on the elbow of the arm with the offending digit and a safety pin is placed lengthwise. When the child flexes the elbow, the clothespin mildly jabs, indicating a second alarm. The bandage is tightened if the thumb sucking persists, serving as a third alarm. Now let's see some of the intraoral appliances which are used in tongue therapy. So there are two types of appliances which are the removable appliances as well as the fixed appliances. Removable appliances, the commonly used ones are the tongue spikes, tongue guards, or Holly's appliance with spurs and rakes can be used. Now coming to the fixed appliances, there are a lot of fixed appliances which are used. Some are the maxillary lingual arch with palatal grip can be given, with hair rakes can be given, lingual arch with short spurs, cord helix with tongue grip can be given, and bluegrass appliance. These are some of the fixed appliances which are used in older children to prevent or to break the thumb sucking habit. Now, there are some certain other techniques which helps in smaller children to discontinue the habit, and this can be performed only during sleep. That is by increasing the length of the child's, like by covering the child's hand, by increasing the length of the child's t-shirt and covering the hand. This can be helpful in discontinuing the habit, but this can be performed only during sleep. Now, there is some more a new concept which is known as the come home concept. In this, a small bag is given to the child to tie around the wrist during sleep, and it is explained that as the child sleeps in his home, the thumb will also sleep in his house. Now, hand puppets can also be given, so that is so the child won't be able to suck the thumb properly. So, hand puppets can also be used to break the habit. The next is there is a book which is given by Dragon Antelos. That is the little bear who sucked his thumb. It's a book written and illustrated by Dragon Antelos on the thumb sucking habit. The book and the chart are a non-invasive and effective strategy for sucking thumb sucking habit. Now, coming to the conclusion, we can say thumb sucking is a it's not a harmful habit. It is like, in summary, we can say that while thumb sucking is often a natural and a harmless habit in children, it is important to monitor its persistence and potential impact on oral health, especially as the permanent teeth develops. Now, addressing the habit early will help in preventing the long-term dental problems associated with it. Thank you.